It's 10 a.m., March the 10th, and Stockbridge. I'm Dr. Charles Kenny. I'm the chair of the Board of Health, and I'd like to call this meeting to order. Jim, would you just state the usual
Sure.
statement?
So this is the Town of Stockbridge Board of Health hybrid meeting in person with a hybrid option. And for the record, Mr. Chair, we do have Dr. Hank Schwerner, who is on Zoom participating as the third Board of Health member. And since we do have a board member on Zoom, all votes and decisions must be roll call vote. And anyone speaking today, whether on remote option or in person, this meeting is being audio and video recorded and will be subject to being posted on public access television. Mr. Chair, back to you.
Okay, just for clarification, a roll call vote means that I'm going to ask Jim to take the vote, and then he goes and says the names of the different people on the board, and they say yes or no, or aye or nay, to agree or disagree or abstain. Okay, so the first order we use an agenda, and the first order of business is an approval of the previous minutes. And let's see if I have my copy here from June 16, 2022. Has everybody had a chance to review the minutes?
Yes.
Hank?
I moved it.
Okay, good, thank you. Okay, so are there any corrections or additions or changes in the minutes?
Just my first name.
Okay, okay, good. That should be Henry.
Yes.
Sorry about that, Hank. Okay. Any other additions, changes, or modifications? If not, I'd like to have a motion to approve the minutes from June 16, 2022 as they are.
So
with that
moved.
change. Okay, a second on that motion? I'll second that. Okay, Jim, would you want to take a roll call vote on that?
Yep, Charlie?
I say aye, Dr. Kenny.
I say aye. Hank?
Aye.
Okay, next order of business is citizen speak time. Now, I'm wondering if we could have a little quiet over there. I'm sorry about that, but this is going to be important for us to be able to hear what's being spoken. I'm sorry, unless these gentlemen stay.
We're gonna let everybody go, all right? We're just here because we're affected by the water issue.
Okay, good. Don't worry about it. Okay, so the citizen speak time is an opportunity for all of you to say something to the board so that we can listen to it. I'm going to ask the board members not to respond to your questions or to anything you say during the citizen speak time. There are several reasons for that. One of the most important reasons is sometimes citizens will say things that are not on the agenda. Now, it's okay for a citizen to say that. That's absolutely fine. But we're not supposed to discuss or get into a discussion about something that's not on the agenda. We'll pay attention to what you said, we look at it and everything, but we can't get involved in it. And that, by us not interacting during the citizen speak time, it makes we're not going to do that. We won't violate that rule of talking about something that's not on the agenda. You can talk about something on the agenda and you can bring up something you want us to put on future agendas. That's totally your right. I'm going to ask everybody to please identify yourselves by your name and your town of residence. And I'd like to ask you to limit your time to 2 to 3 minutes, and especially if you feel that somebody's covered the same territory before, would you please, try to keep from repeating too much. So anyway, I'm opening up the citizen speak time, please. Jim, do you want to handle this?
Sure. Ma'am?
Yes?
You can stand up or as long as everyone can hear you.
Okay, my name is, I'll just take this off temporarily. My name is Denise Forbes. I'm from the town of Housatonic. I'm a Housatonic water resident user. And basically, I've come because the Board of Health in Stockbridge.
I apologize. I'm turning up my hearing aids, but could you please repeat your name and town for me?
I have it, Charlie.
You have it, okay, all
Okay.
right, but
You want me to
I,
speak louder?
Yeah, a little
yeah,
louder.
a little louder, that'll be good.
Usually I'm always told to be quiet. Okay, so basically, I'm a Housatonic water user, and I have been on the system for as long as I lived in Housatonic. The board of Great Barrington Health Board has not taken any stance or done anything to help us. And I find it very disheartening, and I find it very great that you guys are thinking about doing something or taking action or even bringing it on your agenda and dealing with it. We have been faced with such horrific water. These are my water samples that I used when we had a protest in Great Barrington. And basically we were told we could drink this water, it's fine to drink. And we know it's not. I've had my water tested by an Agawam water company out of the area to get good results, and I had it tested for HAA5. I also basically had it tested by the Housatonic Waterworks Company, who tested it the day before I tested mine. And the interesting thing was, they knew they were coming to test my water, and all of a sudden the water smelled like, wow, it's got a lot of chlorine, it's not brown anymore. Let them test it. They don't test for HAA5. They just test for everything else. I have all my results here. So then I had my water tested. I brought it to Agawam. I had them test for HAA5, and they told me it exceeded the levels that's allowable. So I was like in shock. And Housatonic Water Company, they do not test for HAA5 on a regular basis. So it's a scheme where they know there's a problem with the water, flood it with chlorine, test it, the manganese level goes down, everything's fine. Wrong. HAA5 cannot be seen. No one knows it's there. It's only evident if you have tested for it. And we did, because we knew this is the game they play. So once they flood the gates with the chlorine, the HAA5 level goes up. Cancer causing, it's bad. It's really bad. We have been going on with this for years, and it's wrong. Anybody with any kind of bladder cancer, esophagus cancer, cancer in their stomach, any kind of body cancer is attributed to contaminated water, and it's wrong. This company's been getting away with this for over 30 years. And I have the test results to show anyone who wants to see them. But it's just a crazy situation, and we're living with this. My tub, when I took a picture of the water in my tub, I couldn't believe how brown the water was. And I'm expected to bathe my 1-month-old granddaughter in this water. It's crazy. And it's just wrong. And I know this woman who was here with the 2 children, her concerns are the same. We're living in 2023, and we're all dealing with horrible water. Nothing is happening to this company. They continue to take our money, increase the rates, and nothing happens. But anyway, that's all I wanted to say, and I applaud you guys for taking this up and dealing with it. Thank you very much.
You're welcome. Thank you for.
Mr. Chair, through you to Ms. Forbes, how can I get a copy of what you were referencing in that file? If you could, I can give you my email afterwards.
I
You
have
can,
everything on email. I can send it to you any way you want.
Okay.
I can give you copies today.
okay.
'Cause I can make copies.
It'd be helpful for the board to review that.
Yeah.
Thank you.
Okay.
Anyone else Mr.?
Good morning. My name is Bill Nappo. I live at 1081 Main Street in Housatonic. I'm a resident of Great Barrington in Housatonic. And I have submitted to the town of Great Barrington a citizen's petition to have the citizens of Great Barrington and Housatonic take over, own, and operate the Housatonic Water Company because of the situation that we're dealing with in the town. If you gentlemen and your board in town of Stockbridge could reach out and work with our town, with the select board and the town manager in an alliance to handle this situation, would be much appreciated. Thank you.
Thank you.
Thank you.
Ma'am?
Deborah Herman, I live in Housatonic.
Can you speak up a little
I was
louder?
talking about the mask, sorry. Deborah Herman, I live in Housatonic. I just want to mention that a lot of people are affected by manganese in the water, which causes the brown color. But some people, for reasons that I don't think anybody completely understands, the water tends to be clear most of the time. And a lot of those people are not, even though they've been notified, they are not aware of the fact that HAA5 is a cancer-causing agent. And, they think their water's okay. And, I'm very concerned about the fact that people do not know about the health risks. And, because I've been active in trying to, ameliorate this situation, a lot of people contact me saying they have this kind of cancer, bladder cancer or stuff, colon cancer, and is it due to the water? I can't really tell them yes or no, but it is a risk. And I think one thing the health department could do is make people aware of the risk, advise them on how they, even if tomorrow the town of Great Barrington or some other responsible party took over the water system, it can't be fixed immediately. So people need appropriate filters. They need advice on how to minimize the problem in the short run while a long run solution is being made. And I'll just echo Denise in saying that I really feel that Housatonic Water Works needs to be held accountable for their neglect and their indifference to the health and welfare of their customers. Thank you.
Thank you.
Sir?
My name is Fred Coleman. I live at 7 Housatonic Court in Stockbridge. Basically, if you're not familiar with the area, it used to be called the Old Furnace District. We're the suburbs of Stockbridge. We're a quarter of a mile north of the Housatonic line. We get our water in the neighborhood. There's 12 houses, and we get all our water through the Housatonic Water Company. And we have the same issues there that people in Housatonic are having too. The water is just colors. You wonder, like I said earlier, I have a dog, and when I fill his water bowl up from water from the tap, he walks up, sniffs it, and walks away. He won't drink it. And dog's smarter than we are, I guess. And so what we have to do is we have to take a ride up the limits and buy several cases of water to use for drinking, cooking, everything else like that. Coffee pot is, everything we use is filtered. And the filters, which are supposed to last 3 months, are lasting about 3 weeks. And so it's an issue we have. It's, like I said, it's a problem because we're from Stockbridge, but we're getting our water from the Housatonic Water Company. So it's kind of like we're the poor cousins, we feel left out. And we want to know if there's something we can do to help, because it is a situation in our neighborhood where there's 12 houses and almost every single house has had at least one case of cancer of one form or another. I don't know if that's directly related to the water, but I know that I wonder about how it affects your body when you're drinking water that's had increased bleach put in so you can pass a test. What is that increased bleach doing to your body? I know when I worked in the hospital, we used to sterilize things with 10% bleach solution. So here we are, we're drinking a 10% bleach solution. And that can't be helpful for us at all either. Just want to see if there's something Stockbridge can do, because it is a problem that's affecting Housatonic and Stockbridge. Thank you.
Thank you, Mr. Coleman.
We do have someone on Zoom with their hand up, but I guess maybe is there anyone else in person that wants to speak before we transition to that?
I watch the kids for you. Yeah, I'll just speak very briefly so they're not noisy. We live in.
Ma'am, just your name and address, please.
My name is Maya Schulte, and it's 203 Highland Street, Housatonic, Mass. And I, as soon as we got the letter about the HAA5, I think it's called, that was in, I started writing to the DEP in Massachusetts asking whether it's safe for my children to drink. I never got a response. And I think sometime about 5 or 6 months ago, I got a definitive answer, which Deb Herman has, which says we can't guarantee that this water is safe for your children. And my concern at the moment, we're getting Berkshire Springs water, but they're at the age where they like to test me. And so they're drinking it. And I'm trying to remind them every day. But as you can imagine, as a mom, it makes me really anxious that they're putting this water into their bodies. I'm only giving them a bath about once every 10 days because I don't want them to absorb it through their skin because your skin is still very porous at this age. And I guess the final thing is that nobody was able to guarantee me that it was safe for them to bathe in or to drink. And I've asked multiple times, and Deb has the email from the DEP saying, absolutely, I'm sorry, we just can't tell you that that's safe to do.
Thank you.
We have.
Mr. Coleman, can you give us your written address and communication contact links, please? Yes.
I have a piece of paper here, if you could do that if you want. So, Mr. Chair, we'll transition. We have someone named Elizabeth Rockefeller. If you don't mind unmuting yourself and identifying yourself and address for the record, please. Elizabeth, can you speak? There you go.
Okay, can you hear me now?
Yes.
Yes, Elizabeth Rockefeller, 284 Park Street, Great Barrington, which is Route 183, just north of Taft Farms. And this problem has been going on. I've lived here for 50 years. And in the beginning, it was like spring and fall. We were told, well, the water would get dirty, but that's okay. It depends on the water level in the reservoir. And it has gotten progressively worse to the point where, yes, the same as Denise and everybody, we've written to the DEP, to the town board, to the Board of Health. And yes, I understand that these things take time, but Housatonic residents, they have to go out of town to get water, to do laundry because this water stains the laundry. It stains porcelain in your tub and your toilets. And it's not safe to drink. I don't care what anybody says. So I just wanted it known that I support each and every one of these people from Housatonic who receive Housatonic water, and am grateful that you are opening your doors to us too, to help work with the town of Great Barrington. The Great Barrington Fire District has refused to do anything to help us. And just hope another set of ears and topics to talk about that you will help us with. Thank you very much.
Thank you. Is there anyone else on Zoom that would like to speak during citizen speak time? Going once? Going
Okay,
twice?
since there isn't any other citizen wanting to speak up, I'm going to end the citizen speak time and thank everybody who spoke. Okay. Hank, have you been able to hear everything that was said?
Yes, I've been able to hear everything.
Okay, so I would like to move to the next item on the agenda here, which is the opioid settlement funding. Would you want to talk about that, Jim?
Yeah, Mr. Chair, maybe a quick point of order. Since we do have people from citizen speak time, although that's closed, would the board be willing to move agenda item number 4 and swap it out to the opioid to just have that discussion, then do the opioids after that?
Okay, I'm going to ask the board that. I'll take a roll call vote on that, please. You want to take it for me, please, Jim? The motion is, or Jim's suggestion is that we change the agenda order and move the Housatonic Waterworks discussion, which we've just had. I think that was the predominant subject matter for the citizen speak time, and move and exchange that with the opioid settlement. It makes a lot of sense to me. Does anybody want to speak to Jim's suggestion or make a motion about that we do that?
I move we so do that.
John?
I second it.
I agree with that. Okay, so we're going to change the order then, just so everybody knows. This doesn't change the subjects of the agenda. All we're doing is switching the order, and I think it's convenient for the people that are hearing us consider them. It's a good suggestion. Thank you very much, Jim. So I'm going to ask the board now to discuss the Housatonic Waterworks supply discussion and options for action taken by the Stockbridge Board of Health. I have a little bit of background on that. Jim, do you have any background you'd like to speak to first?
Yeah, I think I'll just turn it over to you first and just give an update. I mean, we are in communication with DEP. We've spoken to DEP, the chair has spoken to DEP. We've also reached out to the select board and town manager in Great Barrington asking, if there's, what we're trying to figure out, are there any Stockbridge residents that are affected that have filed complaints? Because we did see a copy of that demand order that certain residents sent in. It was listed, but it didn't have addresses, and the Board of Health did get a copy of that and Tri-Town. But we had a hard time understanding if there were Stockbridge residents. And I know there's a number of households that are served within our jurisdiction. And although the Housatonic Water Works is licensed and overseen by DEP, it belongs in Great Barrington's jurisdiction, but these distribution lines in Stockbridge are maintained by our water department, but that is the only control that they have. And so we haven't taken any action. We're really trying to get an understanding, but the Mr. Chair has spoken to DP as well, and to try to get our handle on what's going on. I mean, we've been sort of following it, but we really haven't been at the table with Great Barrington and even West Stockbridge, because there's West Stockbridge residents that are, so it's a multi-town jurisdictional issue and concern that's happening. And that's sort of like where we're at. And I'll just turn it over to the chair.
Okay, so John or Hank, I've got a number of things that I've done already as background that I can present, but would you guys like to say something first, or do you want to let me do a little spiel first? How do you want to do it? Hank, please.
Go ahead, Charlie.
Okay, so, basically, Jim, now, Mr. Coleman, you're from Stockbridge.
Yes.
Yeah, okay. Now, we have Mr. Coleman complaining, who's a Stockbridge citizen, and I received a concern from another Stockbridge resident about the haloacetic, the HAA5. Now, HAA5, just for everybody, it means haloacetic acid. And acetic acid is a kind of vinegar, but haloacetic acids are a byproduct of the method by which one of the methods by which the state recommends ensuring that there aren't germs in a system by using a halogen like chlorine or bromine. And there are three chlorine acetic acids and 2 bromine acetic acids. And they grouped them together, and they, instead of saying haloacetic acid, bromine, chlorine, whatever, they just say HAA5. So that's what we'll say. They're HAA5. And the HAA5s are a concern that's been brought up here repeatedly by the citizen speak time, and also by that communication I received. And I specifically spoke with Deirdre Doherty, who is what is her title exactly?
She's the Bureau Chief of the Water Division for DEP.
Yeah, she's yes, and she is basically works for the DEP. And I spent about an hour on the phone with her, and she was very kind and sent us a synopsis of my discussion with her. And the background of it is that DEP, at least as far as haloacetic acid testing is concerned, recommends that it be tested every quarter on a periodic basis. Now, I'm not saying that that's the good thing or a bad thing. I'm just telling you the background in terms of what she told me. In addition to that, I know that there are concerns about the medical health consequence of chronic haloacetic acid consumption. And I also know that the DEP, according to Ms. Doherty, solicited from the Housatonic Water Company a list of remediations that they would propose in order to change the level of HAA5, which were elevated on the testing that they found. And the proposed remediations have been submitted to the DEP, and they are reviewing those at the present time. But they did get back to the Housatonic Water Company and approve one remediation method already beyond what they're continuing to review. And that method had to do with a concern that the chlorine was being had a resonant time. In other words, they had a large tank. They have a large tank that they store water in, And by putting the chlorine into that tank, the duration of time that the chlorine remained with the water created an increased amount of these HAA5s. And the DEP proposed to the Housatonic Water Company that they put the chlorine in two different other places along the supply chain, supply line, one before this large tank and the other one after it, as a partial remediation. It not necessarily intended to solve the whole problem because, as I said, they're reviewing some of the other recommendations going along. And as I understand it, that process of incorporating that recommendation is going to be a lengthy one and a very expensive one. Now, that's my understanding of it. So it's not going to happen right away. But it is, the decision to do it is there. I don't know the time frame exactly or what's going to be proposed. The second idea about it is that there are other levels that the water and the DEP recognizes is unsatisfactory. The look of the water, the flavor of the water, these things, whether they be health hazards or not, the water is I think, borderline satisfactory at that point, if acceptable at all with those kinds of, like that colored water that I saw, it looked certainly disgusting to me. And even to have that potentially come out from time to time, if you've got small children, seems to me to be an unacceptable level. The situation I see that also is the case with the Housatonic Water Corporation is that they are a small water company that has taken over what is essentially in Stockbridge, for example, a utility. The utility is a necessary item for a town. We have different ways of combining company and business capitalized involvement in something, and it increases the quality of things. And that comes when you have a competitive situation. Let's say if you're a doctor like myself, you can, if somebody doesn't like it, they go to somebody else. Okay, but in a situation where you have a town with a water supply, you really can't, unless you go to another town, get other water. It's basically, you're stuck with that. And in fact, it really reflects on the quality of a town to have a good water supply. So that's another idea that I got basically from my long discussion there, is that it's a small company.
To look at closer up.
And so the basic idea here is that the DEP has been involved in studying this, but the remediations that I understand that remediation in place is going to take a while to take place, and the other ones haven't been reviewed yet, so that the situation will continue the way it is for a while, at least, as far as I understand it. I'm very concerned that we do actually have Stockbridge citizens and residents who are, having to deal with this. And Mr. Coleman, I think, brought forward his point about it, that his dog won't take it and he has to go and get water from somewhere else. And I do think, with all deference to the people from Housatonic and Great Barrington that are here, that we do have to treat the Stockbridge. I think we have to look at the complaints from our Stockbridge citizens a little differently than we look at the Housatonic ones. And so that's one other thing I'll say before I'll turn it over to John and Hank is that I did communicate with Mark Kruhensky of the Great Barrington, who's the Great Barrington Town Administrator, and the Select Board there. And they have not fielded any complaints from Stockbridge residents that they know of. And Ms. Doherty from the DEP says that she's had over 180 complaints, but over the last year and a half, but she feels that maybe two are from Stockbridge. So it would certainly be something that I would encourage people to do from Stockbridge to come forward.
For the Stockbridge residents.
I'm sorry, is somebody trying to speak there?
If we could ask you to please mute.
Yeah, please mute your, would you please mute that so we can have silence there? Thank you. So I'm turning the discussion now over to Dr. Ladici and Dr. Schwerner and Jim, okay?
Well, as a commissioner of the waterworks here in Stockbridge, we are concerned about our Housatonic residents like Mr. Coleman who are being serviced by the Housatonic water, though they live in Stockbridge. We have approximately 23 families that are in your situation. And until today, I have not heard of anyone in particular concerned, although we expected to hear. And I think that we will take this very seriously, as we will take seriously the complaints of the Housatonic and Great Barrington residents. And as Dr. Kenny says, the EPA is working with us, and we will do whatever we can.
Yeah, I really have very little to add. I think both Dr. Kenny and Dr. Leodici have really summarized what's going on, and I agree with what they have said.
Yeah, and I guess my points being, we have consulted with town council on boards of health have unique jurisdiction in Massachusetts, it's very broad in general with respect to public health nuisances, abatements, so on and so forth. And, we did consult with town council on what kind of jurisdictional authority that the Stockbridge Board of Health may or may not have in this situation. And so it's hard, right? Because the water supply is in another town physically, but we have a distribution line on our side that our town manages, but they don't have a say or control of how the water supply functions in Great Barrington. And so, the chair and I were kind of consulting offline about what the board could possibly do as a start. The board and myself are putting time into this situation, on the phone, requesting information, so on and so forth. And so I think we're all in on this. It's trying to figure out what we can do to support. It's not that we're discrediting the Housatonic residents, but obviously we have diligence to deal with our Stockbridge residents, but we understand broadly, multiple towns are affected by this, including West Stockbridge. One of the ideas I had, Mr. Chair, John and Hank, is would the board be willing to craft some type of letter to request Great Barrington to include us on the goings on, correspondence, so we're abreast in real time to understand what's going on, because that really hasn't happened. I know Great Barrington is doing a lot of different things, possible petition. It'd be helpful for this board and department to just be part of those conversations, to be at the table and possibly sending them a letter asking them to do that for us. And then we could be a liaison for DEP for our residents and kind of keep up what's going on. And I think we can play a role in advocacy and support. But I think the jurisdictional authority it's difficult for us. We can't take action or demand another jurisdiction to do X, Y, and Z. We just don't have that authority.
I like that idea a lot, Jim. Hank and John?
I agree. I think that's a very good idea.
Could
I agree.
Hank?
I agree.
Okay, so can we have a motion to ask Jim to draft that kind of letter for us, and so we can submit it to the Great Barrington Select Board?
Can I just say something? Can you include West Stockbridge in that?
Oh, I'll CC West Stockbridge. Yeah, absolutely.
In your motion of that. So
there's 3 municipalities, right? Great Barrington, Stockbridge, and West Stockbridge.
Okay, so Hank,
I'll make that as a motion.
Okay,
I'll
Jim?
second.
Yep.
Okay, so Jim, you want to take a roll call vote?
Charlie,
Yeah, aye.
John,
I agree.
Hank.
Aye.
Okay, so Jim, you get that together and send it out?
Sure. And Mr. Chair, citizen speak time is over, but people do have their hands up, and it's really up to you if you want to.
Yeah, no, I know that. I would like to say this to you. I know this is a very emotional issue and everything like that. One of the things that I just want you to understand is that I've spent several months trying to get Stockbridge residents to complain because that's where we have our wherewithal to do stuff. Now, please, I don't want to involve you in a discussion. I just want to simply tell you what I've done. So and we've done a lot of homework talking to people and the government and various things. I've spoken to the Housatonic Water Company, Mr. Mercer, and requested him to have the opportunity to come here to speak today, actually, during the citizen speak time. And he promised to send me information and says there's information on the website. But we're just in the very beginning stages here of getting to know what's going on. And Mr. Coleman, I'm just going to say that if you can encourage all of the people in Stockbridge who have concerns about this to come forward and let us know about that, that gives us more wherewithal to go to the town. Now, so for example, John, I'm just wondering, if it turns out that we have Stockbridge residents who have an unsatisfactory water supply, if that turns out to be the case, and if it seems like it's going to take a while to remediate that, is there something that sewer and water can do to help that out temporarily?
Well, as you know, we maintain the distribution lines. I'm not sure that we can change the physical layout of but I think that it's certainly something that we can consider. And I can bring that to our district and talk about possibly rerouting some of those lines. I'm not quite sure, what kind of expenses we would incur and how we would pass that along. Obviously, right now, the Stockbridge residents who are on those lines that are maintained by Stockbridge Water Sewer are paying the Housatonic Water Company the fees. There would have to be a restructuring of the fees, and then there would be a discussion between Housatonic and Stockbridge at that point. But I don't see why that couldn't be looked at. And
John, would you think that if there were more citizens I'm not saying that Mr. Coleman doesn't count, but if there were more citizens from Stockbridge who came forward with a similar concerns, do you think that'd give a little bit more?
Oh, absolutely. Yeah. This is the first time I've heard this complaint.
Complain too.
You complain to us?
Complain to me. I can give everyone's my email at the end, but and I had a couple extra thoughts as well, because people were talking about filters and how long filters last. And I'm not going to opine on what Great Barrington is doing or not doing, but I guess I'm surprised that we're not offering water filtration mechanisms and other things to our residents until this is, I'm not saying that, Stockbridge taxpayers have to take this burden on, but we should have a conversation about if we have 23 homes in Stockbridge, what kind of filter could or could not be utilized, and are there grants out there? Are there DEP grants we can utilize to help our residents?
Yeah, I think those are some good thoughts, Jim. I think we need to get more of an informational base first, and that includes how many people in Stockbridge are really concerned about this. Then that gives us a little bit of thing. But naturally, I think, I'm very sympathetic with the Housatonic and Great Barrington people in this situation. I do think that at the very least, we'll get involved in the discussion with, Mr. Willis's suggestion to send the select board at Great Barrington a letter for us to be involved in the information transfer, so we know what's going on. But in addition to that, I think that I'm hoping. I know the Berkshire edges here. I can see that from looking at the screen. I'm hoping we can give a little more public display of what's going on by, showing some of these things. I know it's been prominent in the press already, but I do think that it is the kind of situation that needs to be brought out more. And I don't think we can make any specific recommendations about what to do about it at this early level, or whether we're actually going to be empowered to do anything about it. But we'll do the best we can to see what's going on. And then we're going to be discussing this again, and we'll be working on it as we go along. So that I'm hoping that we can help the situation out. We always on the Board of Health, and I think Jim Willis has been the guy who's spearheaded this on Tri-Town, is that we're always trying to get cooperation. Okay, we want to get people to work together, and I'm not saying that anything that except that the ideal situation would be to have a harmonious ending to this problem with the water with everybody, including Housatonic Water Company, happy. Everybody. That's what we would like to try to do. But we also don't compromise if we feel there are significant medical issues. I'm sure you can understand that we will try to identify those and do the best we can. It already seems to me that you have a significant problem. So the different suggestions you made, I'm going to certainly consider, as part of our informational gathering process, to also look at some of these ideas, like, for example, the town of Great Barrington taking over the water. And the water supply. As far as I know from the DEP, let's say the practice of having small water companies provide services is almost sort of located only in Western Massachusetts. In most places, the water is provided by the towns.
Yeah.
And that's the way to go, or individual wells and stuff like that. So I'd like to, if the rest of the board agrees with me, I'd like to move on to the next agenda item, but I think that we do need to research this more. And I think, we have some good ideas about what to do next, and I will be working with it. We thank you all for your input.
Yeah, my contact, obviously Tri-Town Health Department's 243-5540. My direct email is just Jim, Jim, at tritownhealth.org. It's tritownhealth.org. We have a website up as well. If you know of residents that want to file a formal complaint, they can. We log every single complaint, whether valid or not, on everything. We log everything, we track it, and then we refer it to the boards and so on and so forth. So, and I know you got my email from somebody and you sent me some stuff. Yeah. It's on the website, but yeah.
I just say, I've been in touch with some Stockbridge residents, but they're just afraid to come forward. People are very fearful on this issue, and it might be good if the town, I understand you know who these people are, if you ask them if they're doing okay, because people they're afraid of the Mercers. I hate to say it. People have told me I should be afraid. I mean, I'm not afraid. I don't think they're gonna come and hurt me, but people are afraid.
Well, this is what I'll say about that. In the first place, if somebody wants to communicate with the board and say that it's confidential, that's fine, okay?
Okay.
But we need to have, let's put it this way, it's a different situation when we have a lot of Stockbridge residents involved. Again, Mr. Coleman, you all by yourself are important, and I'm not meaning to say you're not, but it becomes a different level of problem, and the possible solutions or remediations for Stockbridge are different. If we have a lot of people potentially, I don't know, but I would suspect they might be, compared to if we only have one, then we have a different potential set of solutions that we would take. So I think that being afraid or being intimidated is not a reason. This is a democratic society, okay? And courage is a key aspect of free speech.
Yes.
And if you don't have the courage to say what you want, you don't take advantage of free speech. Okay, that's it. And drawing it out of somebody and dragging it out from it is not free speech. People need to have courage, and they need to step forward. And that's what a democracy relies on, is free speech based on courage. And I'm just going to say this because of our national situation, you have to know what you're talking about. You can't just say something because you don't know what you're talking about, but that's a little digression. I apologize. So please encourage people who feel afraid to come forward and speak.
Okay, I will. Thank you.
Okay.
Thank you.
All right, so let's move on to the next agenda item, which is now the opioid settlement fund. Jim, you want to give us a...
Yes, so a quick high-level overview. So the Attorney General has settled multiple lawsuits across the country with respect to people that have been affected in substance use disorder related to the opioid epidemic. And so what is happening now, so through Tri-Town, working with the Southern Berkshire Collaborative, we've been working with several agencies, including other boards of health in South County, to try to advocate and to encourage boards of selectmen as these funds start to come into the municipalities. Some towns are getting nominal dollars, like Mount Washington's getting like $80. So each municipality is going to get a portion of the settlement funds over the next 20 plus years. Some towns are getting quite a bit, some towns are getting less. And so what the state is asking for is, can municipalities pool these resources and put it towards something that's going to really directly benefit those that have been affected by substance use disorder. So we've been working directly with the Rural Recovery Center in Great Barrington. It's through Real Retreat Youth Project. They have a brick and mortar building now. They do Narcan training. They do mentoring. They actually do direct care services with residents of South County. So our residents in the Tri-Town district are utilizing the rural recovery. Now, the Rural Recovery Center is running out of steam. They only have a certain number of dollars to keep them afloat. And so some of the conversation has been, can the boards of health encourage the select boards to see if there's a willingness to give the rural recovery some of our settlement dollars to keep them afloat, because they're the program and service agency that's directly impacting the residents that have been affected by the opioid epidemic. Towns don't have a plan. You know, what we're trying to do is steer towns away, saying, okay, well, I'm going to buy a few thousand things of Narcan and put it into a storage container. That's not really directly benefiting the residents that are in need. It's going to help save lives, but like, how can we be more preventative and encourage whatever? So in your packet, the Lennox Board of Health, which is part of Tri-Town, met individually. They actually made a motion and vote to send an endorsement letter to the select board to encourage them to give their funds to the Rural Recovery Center. The Board of Health doesn't play any more role outside of that. We don't negotiate how much money, how it gets spent. It doesn't get spent. And so there's an FAQ related to Stockbridge in your packet about how much money Stockbridge is going to get. So for example, Stockbridge through the year 2031 is going to get around $20,000 in the opioid settlement funds. And so I'm asking, and there's a Rural Recovery Center white paper on what they do, the services they provide. I sent it out in an email and physical. And I've been working with them. I work side by side with them directly, and they're doing outstanding work in our communities. And there's no other organization in South County, and I can probably make an argument in Berkshire County, that's doing the work that the Rural Recovery Center is doing. And I really feel like we want our biggest bang for our buck. And I'm going to ask the Stockbridge Board of Health if there's an objection to writing the select board a letter supporting that our opioid settlement funds be utilized in a way that supports the Rural Recovery Center. We don't have any control over the purse strings. We can't decide how much, whatever. It's really just an advocacy thing. And you'll see the Lennox letter in here that I drafted. Thank you. So really I'm asking the Board of Health if they'd be willing to consider asking the select board to use those funds to support the Rural Recovery Center.
I think that's a great idea, Jim, and I would like to make that as a motion that we support Jim Willits in this letter to the selectmen so that we would utilize those funds for the rural recovery.
Is there any, I don't know who else is on Zoom that may or may not be here for this topic, but I don't know if there's any other discussion or questions directed to me on this.
Hank, did you get that?
Yeah, I got it.
Okay.
I'd like to second the motion.
Okay, I'd like to have a little discussion about it before we vote on that. And so can I just go over a couple of points with you, Jim?
Sure.
Okay, so first of all, how did Stockbridge get assigned the $20,000 or so?
Very good question. There's a very complicated not understandable equation and how they distribute the funds across the Commonwealth. While I don't notice to be certain, I think some of it is about the number of incidents of overdose.
And you get this how? From the police department and the?
So basically, the settlement funds are going through the Attorney General's office. A lot of municipalities already have FY23 and FY24 funds sitting in their bank accounts without even understanding how to use it, when to use it, so on and so forth. So the formula, so this sheet right here is a very busy sheet. There are various lawsuits and various companies that are settling these funds across the Commonwealth. J&J, Walmart, and all these other companies that contributed to the opioid epidemic.
Yeah, okay, let me just get back on track here. Really, could you give a little bit better explanation of how Stockbridge was assigned this amount of money?
Well, I'm trying to explain that.
Oh,
No one really knows.
You don't
I think
know.
it's based on a number of opioid overdoses, deaths, so on and so forth.
Okay, and all right, so let me ask another question. Is there a deadline on this kind of a recommendation to the select board?
There sort of is. So there's pending so right now, the Attorney General gave out documentation that the select board has to appropriate this funding at town meeting. But there's possible legislation that's not going to happen, where the funds are just going to go right to the towns, and then the select board decides on the appropriation of who it goes to and how it's spent.
So right now, there isn't any deadline.
Not right now.
Okay, all right. Now, third question. Is there a way that you can tell me that the Stockbridge allotment, as it is, the $20,000, going into this, more general fund, is not going to adversely affect the people who need it in Stockbridge, who served as the basis for this $20,000?
It won't adversely affect. It's the opposite. They'll be supporting our Stockbridge residents through the Real Recovery Center.
Okay, so this is what I would like to do. If there's no deadline, okay, I'd like to table this discussion until the next meeting that we have, which I hope would be relatively soon. And during that period of time, I'd like to get the answers to these questions a little bit more specifically, so I can understand what we're going to be asking the select board to do. And so if we go before the select board and actually talk about the impact of this on Stockbridge, that I can give them some pretty good statements about it. The board can put this into our whatever proposal we want. And I would like to ask Hank and John in the meantime to look at this in detail, and I'll do the same thing and confer with you.
Yeah.
If you have any questions, and then we can get back and we can put together an idea about whether, how we would like to tell the select board what to do. Does that make sense?
Sure. So I think I need to clarify the questions. I need the questions so I can work with our partners to find those specific questions. And I'm okay with tabling it, but I will ask that we meet again within like the next month.
Yeah, absolutely.
Yeah.
We have to deal with this, some other issues too that we'll be dealing with. And I think that'd be a good idea. What do you think about that, Hank?
I think that's a reasonable idea. I've been involved in some of the meetings with the South County group, and I think I have a little more understanding, but I think we all need a little more understanding about this if we're going to go before the select board. So I agree.
John?
All right, then I'll withdraw my
No,
motion.
you don't have to withdraw it. It's tabled.
It's tabled.
Okay, we'll pick it up. We'll have.
Well, no, he's got to withdraw the motion because his original motion is to approve and send a letter. So he's got to withdraw that motion and vote first.
Well, this is what I would say. I mean, I'm going to disagree with that. We can table the discussion on the motion and resume the discussion on his motion at the next meeting. And then at that next meeting, we can either approve or not approve it and move on to the thing. So,
Yes, but there's two potential motions. Just follow the rules.
I'll listen.
Which John should make a motion to withdraw his motion to send the letter first.
All right, so let me make that statement, withdraw the motion.
Okay, so what is the other motion?
It's going to be the motion to table. There's two separate things going on here.
And I make a
Okay,
motion.
got it. I agree with you. Okay, I'll agree with you.
So two motions. First motion is I withdraw the first motion and I make another motion, and that is to table the discussion till the next meeting.
Okay, so let's make the motion to withdraw sending a letter first.
Let's.
With a second.
Okay, so
So the first motion is to withdraw the motion to send a letter. The second motion is
No, we need a second for that.
all right, I need a second.
Second.
Roll call vote.
okay, I agree.
John,
Aye.
Hank,
Aye.
new motion.
Hank agrees too.
New
Okay,
motion is to table this until the next meeting.
okay.
Second.
Hank second. May we have a vote, Jim?
Roll call vote. Charlie,
I agree.
John,
Aye.
Hank.
Aye.
Okay.
Okay, good. Thank you, Joe. Thank you. Okay, so sorry about that, Jim. I think we need to move on to the next agenda item. And
Updates. Just a few updates. We'll wrap up here. Couple things. Our final FY24 budget has been submitted to the three towns. The board had initially preliminarily approved the budget back in December, but it takes a few months to sort out the fringe benefits and the final line item. So that's been submitted to the towns. That's going on. We did make a press release that our nurse program is offering the COVID booster shot with a $75 gift card to various businesses. She's doing a lot of vaccinations on that. For those that are interested in getting the COVID booster that may qualify for the $75 gift card, they should go to our website, www.tritownhealth.org. We have flyers everywhere on that. So that's kind of going through the end of March. A reminder that we're pushing a lot of the car seats out as part of our car seat program. You do have a flyer in front of you as well on the website about the spring household hazardous waste collection, which will be May 20th, 2023 from 9 to 1. We do require
could you say that
pre-registration.
a little slower, Jim?
Oh, I'm sorry.
Everybody can hear that.
So the Southern Berkshire Household Hazardous Waste Collection Spring Event will be Saturday, May 20th at the Lee Wastewater Treatment Plant from 9 to 1. We do require pre-registration, so go to the Tri-Town site and sign up for that. What else is going on? I do have to ask the board of your availability for the Tri-Town District meeting, which right now is looking at March 26th at 6 p.m. I did send an email. Still waiting to hear back from a couple board members. We have to post that. Hank and John, I'm not sure. I think Hank, you may have gotten back to me, but I just need Charlie and John, your availability so we have a quorum.
Did you say the 26th?
The 26th will be full remote at 6 p.m.
I've got that as a Sunday. Is that correct?
Yeah, that is a Sunday.
Wait a minute.
It's the 27th, 28th, and 29th
Oh my
you
God.
asked for.
Oh,
Yeah.
it's a Sunday?
And I think you said the
You said-
29th.
Right. You said
Oh,
the
geez, 29th.
27th.
Oh, I'm sorry. March 29th. What am I doing? March 29th. That's right. We don't want to meet on a Sunday.
No.
Well, unless people are bored.
I'm good with that.
Okay, good. So I'll work on that. We have to do the public hearing for the tobacco regs and so on and so forth. And, John from our office is here. We had a couple housing complaints that we're following up on, 33 Main, working with fire building inspector on that. And we did have.
Standing by, Joe.
It's 28 Main, by the way.
28 Main, sorry, look, that's why I try to pay people the big bucks. 28 Main, so that, we're working with that. We did have two separate complaints over at Pine Woods. One was a referral from the fire chief that John was working on, and we had another housing inspection where we had a couple violations, and that was sent out. Outside of that, unless there's specific questions from the board.
I have a specific question.
Sure.
Okay, with respect to the household hazardous waste, I'd like to make sure the public understands what that is.
They should, because we've been doing it for 25 years.
I know, but, there are always people that like to are new into the loop. So can you just explain how that works? What can people do in their houses, from their houses, to go to the Lee wastewater treatment plant on Pleasant Street, to dispose of things in their house.
Yes.
What things can they dispose?
Yes, and we do have a flyer on our website that has a listing of everything that you can and can't bring. So I won't read them all, but basically we have 17 towns that participate in the household hazardous waste collection. We do 2 events a year, one in the fall in Great Barrington, one in the spring in Lee. And, pesticides, herbicides, sprays, anything other than like latex paint and propane and certain things where you can't bring. You pre-register, you bring whatever you want. There's no limited amount. People can bring whatever they want, as long as it's not a commercial company. We're talking households, citizens bringing this kind of stuff. We take it all. It's all part of the assessments that the towns all participate and put in. We hire a vendor that does all that. John and Jason and other staff work it. And really what we're trying to do is prevent people from taking these chemicals and put them illegally into the waste stream. So we want to encourage people to bring these things to the events, car wax, drain cleaners, thermometers, lead and oil-based paints, varnishes, solvents.
And this is quarterly.
We do it twice a year.
Twice a year. Okay,
Twice a year.
so the bottom line is anybody who's listening or is going to look at this in the future is that there are lots of things that you could hang on to and then bring them on that date, and Jim mentioned a lot of stuff that's is on the website. It goes from all sorts of pesticides and fungicides and that stuff that you might have in containers that you would wonder what to do to get rid of, preservatives, all sorts of stuff you would use in your workbench, paint thinners, things like that, stuff from the house like oven cleaners and stuff that you have excess of, from your garage, gasoline, fuel, leftover oil, if you change, from a 2-cycle engine to something else. And then you have all sorts of things like thermostats, thermometers and stuff, and rodent killers. So save those things and then you can bring them there twice a year. So that's the point. Okay.
Yep.
Right.
Yes.
Good. Thank you, Jim. Okay. So does anybody else have any questions on the updates of Jim, Hank, John?
No?
Okay.
No.
All right, well, I want to thank you both, and Jim, you too, and John for attending today. And I'd like to have a motion to adjourn the meeting since we covered the agenda.
So
No,
moved.
okay, second.
Roll call, Charlie,
I agree.
John,
Aye.
Hank.
Aye.
Okay.
Thank you, everyone.
So it's passed. Thank you.